My dear friends, I'm your friend, a colleague, Dr. P.P. Bose, Parthapratim Bose, a practicing pulmonologist in southern part of New Delhi. And I'm into active clinical practice for the last 3 decades. And many of you must have read me or heard me. We might have met in many of the conference and academic summits. The post-COVID planet is entirely a different planet. The people have struggled to improve their communication practices through right kind of digital tools. Me and my whole team have been working very hard to disseminate knowledge to our colleagues, our junior people, and the people at large, what we call the respiratory care practitioner, which comprises of physicians, pulmonologists, anybody who's into respiratory care. Could be a nurse practitioner, rehab experts, home care experts. So we are regular into a lot of clinical practices. Presently, I'm a senior consultant and faculty at National Heart Institute. I visit couple of corporate hospitals like Fortis, Mulchan, and I'm the founder of SANS Foundation, a recognized Director General Health Services, nursing home, and a foundation in advocacy, research, and other activities. I also run a paramedic forum by the name of Suction to skill respiratory care profession and related services. For the last 2-3 years, we are running a forum called Clinics in Chest Medicine. Many of you must have attended our seminars and online programs and hands-on workshops. Clinics in Chest Medicine is a forum to disseminate knowledge through conferences, CME series, digital programs, podcast. Currently, we are into a lot of digital disseminations. Our Embrace Zindagi is a forum on wellness. It's quite popular. Many of you must have heard of. Our National Heart Institute Radiology podcast is another initiative. Basically, we are discussing our interesting cases, right from basic X-ray, CT scan to difficult cases. Our Clinics in Chest Medicine is basically a forum to dedicate, I'll just read out, it's a to provide a state-of-art continuing medical education in the field of respiratory critical care C and rehabilitation. It is in short called CICM India, is dedicated to fulfill of this mission through following means: offering excellent educational program enabling professionals to provide superior medical care for patients suffering from respiratory and allied diseases, enhancing dissemination of current research knowledge, ensuring that professionals have timely and relevant information available, facilitating a career-long continuum of medical education in respiratory and allied sciences, fostering innovation in current medical education programs, being a resource and model of course directors and educators involved in CICM educational activities, and last but not the least, enhancing the value of care by improving quality and patient safety. So friends, we're into total, holistic approach for better care. We are shortly starting a summer crash course on pulmonary rehabilitation. In National Heart Institute, we'll be running those weekend courses on this clinics in chest medicines. So we are making this WhatsApp group for our different activities. This is primarily for the physicians, pulmonologists, and anybody who is interested in your respiratory care practice. Feel free to discuss with us, share your ideas, get involved. If you want to get involved in any form, we are there to help you in all kinds of your endeavor. So we are also running a certificate courses called advanced certification courses. Advanced certification courses have different modules, and this kind of certifications, which is recognized by different national colleges, and our forums and National Heart Institute will be given to you. We are shortly about to start our advanced certification in respiratory care called ACRC based on different modules. Module A is ABCD triage, BLS and ALS, respiratory assessment, spirometry, and oxygen therapy. Module B is divided into module B1 and B2. B1 is respiratory system and approach, allergic rhinitis, asthma and COPD. Module B2 is interstitial lung disease, sarcoidosis, pneumonia, tuberculosis, pleural effusion. Module C, which is on intensive care, that has been divided into two types, C1 and C2. Module C1 is on metabolic syndrome, infection control in ICU, good nebulization practice, arterial blood gas, fluid and electrolytes, sleep disordered breathing. Module C2 is non-invasive ventilation, mechanical ventilation and transportation of critical ill patients. And module 2 is pulmonary rehabilitation, because it is a decade of pulmonary rehabilitation. We have to go beyond molecules. Pulmonary rehabilitation, nutrition, postural drainage, long-term care, and hospital hands-on training. Long-term hospital hands-on training. So if you are interested in any kind of module, any kind of dissemination program, in any form, just share your ideas in this WhatsApp group, and we will be regularly disseminating knowledge. Whatever we have been doing, our offline and online programs we'll be sharing in this group. So please text me through WhatsApp, through audio, on my number 98101596887 for all your inputs. We are there always to help you on all your endeavors. Thank you so much. Warm regards, Dr. Bose.